During this presentation, you will learn how to use the Assist-FC to identify individuals who may be using multiple psychoactive substances that put them at risk for health and other problems. The Assist-FC is a shortened version of the World Health Organization's Alcohol, Smoking, and Substance Involvement Screening Test, known as the ASSIST, which you may already be familiar with. The Assist-FC is a subset of questions from the full ASSIST that is comparable in psychometric properties for the classification of low, moderate, and high-risk substance use. As a brief background, the full ASSIST was the first screening test to cover all psychoactive substance categories, including alcohol, tobacco, and illicit drugs. It screens for health risks and problems associated with substance use and provides both lifetime and current estimates of substance use and related risks. The ASSIST can help identify individuals who may be at risk of developing problems related to their substance use in the future, and it can also identify substance use as a contributing factor to the patient's presenting illness. The ASSIST can be linked to a brief intervention to help moderate-risk substance users cut down on their use and to motivate high-risk users to accept a referral to treatment. Although the full 8-item ASSIST has acceptable psychometric properties and has been widely translated and disseminated, it is considered by health professionals to be relatively long for clinical use in some settings. So to answer the call for a screening test that is shorter than the ASSIST, but with comparable ability to classify individuals' risk, we developed the Assist-FC. It is called the Assist-FC because it contains only the frequency and concern items from the full ASSIST, and we reduced the number of substance categories asked about in the full ASSIST, thereby further shortening the instrument. So now, we'll walk through the proper way to administer the ASSIST frequency and concern short form. Introducing the screening instrument is particularly important for patients who may feel that they are being singled out for screening services. So a few key elements that really must be emphasized in the initial interaction include a statement indicating that screening is universal. You can start by saying, "We ask all patients these questions," that alcohol and drug screening is a standard of care. We are asking these questions because the use of substances may affect your health and can interfere with many medications, and that the information they provide is confidential. Like all aspects of your medical record, the information we talk about will be kept confidential. Using a standardized introduction is important and can help in a number of ways. It provides a rationale for the questions, it informs patients about what you will be asking about, and it defines a time window of interest. It is helpful to also provide anchor points for the past 3 months, such as from the 15th of May up until today. It is also helpful to provide the patient with a response card that includes a list of the substances that you will be asking about. The response card for the Assist-FC shows a list of substance categories along with the generic or slang terms associated with them. The bottom of the card also shows the patient the response options for the 2 questions. This list can be modified to include the 5 most prevalent substances in the location in which it is being used. Due to low prevalence rates, we have removed the inhalants and hallucinogens categories from the list. However, they can be added back in or asked about and recorded in the other category. We've received a lot of positive feedback about the usefulness of this card in medical settings. However, note that patients with limited literacy skills may be put off or intimidated by a list like this, so use your judgment in determining when it is appropriate to offer this response card. When querying patients about their alcohol use, it is important to remember that generally speaking, there are 2 types of at-risk drinking. One is having too many drinks on a daily basis. The other is consuming too many at one time, commonly referred to as binge drinking. Because alcohol use can affect your health as well as create a number of other problems, the National Institute on Alcohol Abuse and Alcoholism recommends guidelines for lower risk drinking. Healthy men under the age of 65 should have no more than 2 drinks a day, 14 per week, and no more than 4 on any one occasion. For women and men over the age of 65, the limits are 1 a day, 7 in a week, and no more than 3 on any one occasion. It's important to remember, however, that for some health outcomes, lower levels of consumption on a daily or irregular basis are still linked to negative consequences. Most screening assessments include a question about the frequency of consuming too many drinks on one occasion. A common question would be, for women, how often do you have 4 or more drinks on one occasion? And for men, how often do you have 5 or more drinks on one occasion? When asking patients about their alcohol consumption, it is important that they know what you mean by a standard drink. In the United States, one standard drink contains 14 grams of pure alcohol, or 0.6 fluid ounces. You can find the percent alcohol in the beverage label, sometimes referred to as ABV, or alcohol by volume. So a 12-ounce can of beer containing 5% alcohol is one standard drink. A 5-ounce glass of wine containing 12% alcohol is one standard drink, and a shot of 80 proof liquor is also one standard drink. You should always make sure that your patient understands these parameters when describing what they drink. Using a visual aid that shows what a standard drink is can help make sure that you and your patient are both on the same page. For example, many of today's craft beers are much higher in alcohol than they used to be. This one is 10% alcohol by volume, compared with 5% as in most mass-produced brands. So here you can see the actual assessment. The introduction is at the top of the page and can be directly read or paraphrased to patients. Question 1 asks about the frequency of substance use in the past 3 months, which gives an indication of the substances which are most relevant to the patient's current health status. For each substance endorsed in question 1, immediately ask question 2 for that substance. Then move on to the next substance. If the response is never to all of the substances in question 1, end the interview. Question 2 asks whether anyone has ever expressed concern about the patient's use of the substance and how recently that occurred. Concern can come from anyone: a partner, parents, children, friends, an employer, a colleague, or a doctor. Regarding the alcohol section of the full assist, a long-standing criticism is its inability to identify heavy episodic drinking, especially in individuals who may do so infrequently. Patients who binge drink occasionally may score in the low-risk category on the assist, even though they are at risk of acute injuries or accidents from intoxication and would benefit from a brief intervention. The full assist only used this frequency question in order to maintain compatibility with the other drug classes. Because of this deficiency, a supplemental binge drinking question is often included in the screening process. So you will notice that after the alcohol frequency question on the Assist FC, there is a question that asks about binge drinking. How often have you had 5 or more drinks on one occasion? 4 for females. Although the addition of the binge question alters the original structure of the instrument, we suggest it as a practical option in that the Assist FC may be administered with or without the question. Based on preliminary analyses, the scoring and accuracy of the Assist FC alcohol score could be improved by replacing the alcohol frequency item with a binge question. So when we score the Assist FC, an answer should be recorded for each substance category in question 1. If a substance was never used or has not been used in the past 3 months, never should be circled. For question 2, an answer should be recorded only for substances the patient reports using in the past 3 months. For individuals who report drinking alcohol, question B1 should be asked about the frequency of binge drinking. Note, as you can see from the form, this item is not counted in the scoring for alcohol, but if the patient otherwise scores in the low risk range for alcohol, yet reports binge drinking, a brief intervention should be delivered. For each substance, add up the scores received for questions 1 and 2. In this case, you can see that although the patient scored in the low risk range for alcohol, a brief intervention for alcohol should be delivered to discuss the risks related to binge drinking. Note that the patient also scores in the moderate risk range for marijuana. So in the end, you have a substance-specific score for each drug. Scores of 0 to 5 for alcohol and 0 for all other substances indicate low risk. These individuals are not reporting use of any drugs, and the frequency of their alcohol use is likely within the recommended limits. Educational feedback is recommended for these patients. Scores of 6 to 8 for alcohol and 2 to 6 for other substances indicate moderate risk. These individuals are reporting some substance use and may be experiencing some health, social, or financial problems. A brief intervention is recommended, and where time permits, additional substance use information should be collected by administering the full assist. Scores of 9 to 12 for alcohol and 7 to 12 for other drugs indicate high risk. These individuals are likely experiencing more severe health and other problems related to their use. Provide a brief intervention to help reduce risk and to facilitate a referral to specialist treatment. Again, additional substance use information should be collected by administering the full assist. Remember that you still need to use your clinical judgment in interpreting the scores. For example, a patient may drink every day and only consume one standard drink. Despite being within the guidelines of lower risk drinking, she will score in the moderate risk range. Likewise, a patient may score in the low risk range for alcohol, but the information from the binge drinking question will help inform the provider about additional risks the patient may be experiencing. If the patient reports that they drank 5 or more drinks on one occasion, 4 for females, a brief intervention is recommended, even if the assist alcohol score is classified as low. Therefore, if time is of the essence, the Assist FC has been statistically validated to use as a standalone instrument providing comparable risk levels with the full assist instrument. A major strength of using the full assist is that the patient and provider enter into a dialogue, encouraging the patient to talk about his or her substance use, and at the same time, provide a basis for a brief motivational intervention with the patient. Therefore, it is recommended that for those who screen positive on the Assist FC, and where time permits, additional substance use information be collected by administering the full assist.